Hello dentist, how are you? Today we're going to talk about the difference between files and reamers, okay? And then we're going to talk about the criteria for obturating a root canal. And then we're going to talk about the features of an ideal root canal filling material. And finally, we're going to talk about the techniques that obturate a root canal with this material. Okay, let's start with the difference between files and reamers when preparing a root canal. A file has a much tighter spiral along its length and produces a cutting action when withdrawn. So its way of action is the cutting action. So and when withdrawn, when we withdraw from the canal, from the root canal, whereas the reamer has a looser spiral and is used by rotating and withdrawing. So in case of reamers, we rotate and withdraw. In case of files, we cut and withdraw when withdrawing. Okay, when we cut, we withdraw. While in case of reamers, we rotate and withdraw. Okay. Okay. Let's go next. This is the shape of the file and the reamer, the difference between them. This is how they look like. Okay, this is a file. Okay, and this is the canal, and inside the canal, can you see this is the root canal file inside a canal molar. So what's the criteria for obturating a root canal? Let's start. The root canal must be completely prepared, should be dry and asymptomatic. So the pain, there is no symptoms, okay, and the root canal is completely prepared and it's dry. There is absence of swelling and pain, so there is no pain and no swelling. There's no tenderness to percussion, so if we hit with the other side of the mirror, okay, there is no tenderness to percussion, because tenderness to percussion indicates that there is a periapical pathosis. So there should be no periapical pathosis, no inflammation. There is no patent sinus tract, okay. The canal odor is free. There is no pus, okay, because pus will indicate there is infection. There is fetid odor, okay. Some cases may be medicated for 1 week depending on the severity of the case. So when we have a patient who has periapical pathosis or periapical infection, we should postpone the treatment plan. Okay, we can give the patient antibiotics and postpone the endo treatment. Okay, so what we do, we tell the patient to come after 1 week in order to start filing and obturation. Okay, and it's very important to make periapical radiograph. Features of an ideal root canal filling material. So the material should be not irritant, be non-irritant to periapical or periradicular tissues, easy to handle, insert into the root canal and remove if the root canal filling fails. Okay, it should be radio opaque, should not stain the tooth tissue or be visible through the coronal tooth tissue. Sterile, should be sterile. It should be bacteriostatic. Good sealing to the root canal and be stable, not shrink, and be impervious to water or liquids. Techniques that obturate a root canal with this material are lateral condensation, could be warm or cold, vertical condensation, thermomechanical condensation, thermoplasticized Kataperka, single point technique, carrier-based techniques. Okay, so these are the techniques that obturate the root canal with this material. We have two here radiographs. Okay, we have here a necrotic pulp due to decay. This one here, this is a necrotic pulp. Can you see here? This is the pulp, and this is a radiolucent area. We have here caries, okay, and the pulp is exposed, okay, and there is infection, okay. So this is necrotic pulp due to decay. So the pulp is dead here, okay. And this is after filing. So we make filing and then we make obturation. This is after filing and obturations. Can you see? This is the gutta perca. How does it look like? The pulp looks radiolucent, while here the gutta perca after being the canal after being filled with gutta perca looks radio opaque, okay. And this is the filling material, also looks radio opaque. Can you see? This is the caries, it looks radiolucent. Can you see the difference? So here this is a necrotic pulp due to decay, and this is the root canal cleaned and filled. This is cleaned and filled with gutta perca and filling material, okay. Okay, let's go to the next. A successful root canal filling. How can we make sure that we did a successful root canal filling? First of all, make sure that you take a good case history of the patient, okay. Make sure the patient tells you if there is any infection, any pain, any swelling, or whatever it is, okay. So you have to know exactly the chief complaint, okay, and take a good case history. Also, absence of any reports of pain, swelling, discharge, and mobility of the tooth. If you want to make a successful root canal filling, you should have no pain. Patient should not complain of pain, swelling, discharge of pus, mobility of the tooth. In this case